Mechanical ventilation is a procedure often performed in patients in respiratory failure, which is defined broadly as the inability to meet the body's needs for oxygen delivery or carbon dioxide removal. A ventilator delivers air, usually with an elevated oxygen content, to a patient's lungs via an endotracheal tube to facilitate the exchange of O2 and CO2. The indication of mechanical ventilation includes airway protection, treatment of hypoxemic respiratory failure, removal during the respiratory failure via an artificial respirator called a ventilator to keep your blood gases level towards normal. Goals of mechanical ventilation: proper gas exchange of O2 and CO2. Treatment of hypoxic and hypercapnic during respiratory failure. Reduce work of breathing. Achieve patient comfort. There are two ways of ventilation: non-invasive and invasive ventilation. Non-invasive ventilation significantly reduces the requirement of intubation. Face masks are required for ventilation. Most commonly used in home care or patient need to be put on CPAP or BiPAP and where intubation is not suggested. Expected leakage through face mask. No direct access to bronchial for suction. Less effective and can be used only on NIV modes. Patient is ventilated through endotracheal tube. Chances of leakage is very less. All ventilation modes can be used with invasive ventilation. Recommended to be used with patient having complete respiratory failure. More effective than mask ventilation. Direct access with suction. Needs of mechanical ventilation is based on the equation of motion that states that total amount of pressure that need to be generated to overcome the pressure due to resistance and pressure due to elastance work. Spontaneous breathing patient generate negative pressure to do this work, and first widely used ventilator was the iron lung. Modern mechanical ventilator based on the concept of positive pressure ventilation. Invasive mechanical ventilation delivered via endotracheal tube, where it addresses the pressure required to overcome the work by delivering a set pressure directly via pressure control modes or pressure support. They can also address the work by applying a set amount of flow and volume to be delivered with modes volume assist control modes. In this case, total amount pressure which is generated is directly related to resistance and elastance of respiratory system.